in an article which I came across on the conversation. And the title of that article is Fake Medicines Are a Dangerous Threat in Africa. And you begin by, painting this picture of somebody who has a long headache, rather a headache after a long day, right? And they then go on to buy painkillers from a street vendor. They take two of those. And the question you pose there is, how do you know what those pills really are? And you do state that the vendor isn't a pharmacy and there's no package insert listing the ingredients, neither the dosage instructions. So this, I think, is a very important question. And I think this topic itself, since we've only got about 10 minutes or so to discuss this, I think we don't really have the time and, the scope to actually dig right, as deep and at length as this topic actually deserves. But nonetheless, I think let's begin by maybe trying to understand the situation regarding fake medicines. I mean, many people seem to be unaware of just how prolific fake medicines are.
Okay, yeah. Thank you very much, Zahid, for inviting me. So it's that a lot of people are aware of fake products, Gucci bags, sometimes even, fake foods. But then somehow they assume that there are no fake medicines. So the whole counterfeit business is worth billions and billions of dollars. And one of the most common things that counterfeiters get into is fake medicines. And this could be pharmaceuticals. They could also be herbal medicines, by the way. And in pharmaceuticals, they tend to, like any, if you like, good business people, they tend to look at things that are in high demand. And these would be things like, pain medicines, because everybody at some point, will use pain medicine. In countries where there's malaria, for instance, they might tend to go for malaria medicines. Fortunately, in South Africa, we have, for HIV, for instance, we have the national program which provides free medication. But you find that in parts of Africa where that medication would be expensive to access, they would also get into that market. In sexual dysfunction medication, like the Viagras of this world, and then weight loss medicines. So it's a big market with potential huge risks. Yeah.
And you do say that it is a big market, and when you actually mention some of the stats in your article, you say there's a high prevalence of these substandard medicines. For instance, you mentioned 88% of antimalarials in some African markets have actually been reported as being fake. So I think the question then is, who's actually supplying these medicines, and how are they able to distribute them, with all the regulations that are in place to avoid this kind of a situation from actually occurring in the first place?
Okay, maybe it's important for us to kind of define counterfeit medicines. So when you talk about counterfeit medicines, you also talk about fake medicines, which are deliberately made and then infiltrated into markets on the one hand, but you also talk about substandard medicines, which are made by companies but are just not meeting the right standards. And sometimes it's because those companies have lax quality control systems. Now, when you look at the fake medicines, to focus on that for a bit, these would come from the same source markets where you get fake iPhones, fake Gucci bags, right? So mostly out in China, India, and this is almost organized crime. So it's not that those governments are involved in this. It's just criminal syndicates that involved in this, and they would then infiltrate products into markets globally. Actually, I think you might have heard of fake iPhones getting into the US market, and nobody was none the wiser for it. And then when it comes to substandard products, These are sometimes manufactured on the continent, and because maybe we don't have rigorous quality control standards, and in most cases, some of these ingredients we don't have control over. So companies might bring in ingredients under the belief that they're good quality ingredients, and then they don't really test them rigorously.
But then
And
when
in
you
the
look,
sorry,
yes,
yeah.
please do
So
go on.
yeah. So in the recent case, for instance, in the Gambia, there are 66 children who died from cough mixture which was contaminated. So this came from a legitimate supplier, but the quality of the ingredients that went into that was really poor. In fact, it was toxic compounds, industrial chemicals that were mixed into this product.
Exactly, and I think when you look at the stats, it's a really sad picture. You say, ineffective medicines have been linked to around 64,000. Anywhere between 64,000 and 158,000 deaths from malaria every year in sub-Saharan Africa.
Yeah, and almost 250,000 children globally. Just in the past 9 months, the WHO has reported 300 deaths in children due to these cough mixtures that seem to be having industrial antifreeze, actually, industrial chemical in there. And these deaths have occurred in Indonesia, in Kazakhstan, and in the Gambia.
Mm. Let's
Yeah.
look at the impact that these fake medicines have. Aside from the unnecessary deaths that these seem to be causing, the healthcare system in Africa. How does this affect patients and healthcare providers in the fight against various diseases?
Well, it's huge. So I always say, if you buy a fake Gucci bag, nothing happens to you. But then if you buy a fake medicine, um, the worst is that there's death. But then the other thing is the disease itself, because in some cases the fake medicine doesn't actually have any mm, compounds. It could just be starch, for instance, that's pressed into a tablet. And in that case, if you have a disease, then the disease progresses, right? So let's say you have diabetes or you have HIV and you're taking something that's actually not therapeutic. So then there's progression of that disease. There's cost to you as a patient because you keep going back to, and eventually you might even lose trust in the healthcare system to say, but these guys keep giving me medicines and they're not working. And then, of course, the economy suffers because companies that are legitimately working in the pharmaceutical industry would lose out on, their reputation is damaged. People don't trust healthcare professionals anymore.
Hmm. And I mean, I think when you look at the stats, which I'm going to keep referring to because I think it paints quite a dramatic picture of a devastating picture rather of the situation that we actually find ourselves in. And I think it keeps me wondering, why are we not having more conversations around this? I think your article was probably the first that I actually came across regarding this topic, and I feel like there does actually need to be more conversation around this. Who do you think, just quickly, uh, should actually be taking responsibility for this, firstly, and who should actually be at the forefront of now, eradicating this situation?
Yeah, okay. So there are quite a lot of moves going on at the moment. So WHO, for instance, has recognized this. So they are now looking at how can we be training healthcare professionals, and also, our regulator in South Africa, SAPRA, for instance, is very alive to this issue. Even though South Africa is one of the safer countries on the African continent, partly because of the good work that SAPRA does. But everybody has a role, right? So this conversation we're having is very important because we are educating and creating awareness for members of the public.
Mm.
So apart from governments, apart from having better border controls, the consumer, right, has a very important role. And that's why we say, when you go and you buy bread, right, you always look at it. you look at the expiry date, you inspect its integrity, and then you make a choice. So it's the same thing with medicines, that when you buy medicines, especially when you're taking the same medicines, when you get home, even when you're taking it, look at it all the time, inspect it, and see if it actually matches what you previously took. Yeah, and if there are any effects that you're feeling which you shouldn't be feeling.
Let's
Yeah.
talk about that for a moment. How do you then, as a consumer, then, differentiate it between fake medication or substandard medication and genuine medication?
Okay, so the most important thing is to source your medication in legitimate sources, right? So retail shops are licensed, pharmacies, dispensaries, right? Not, as in the case of the article, the street vendor. So that's the one thing that we need to, risk-based, right? So go for legitimate sources. Then the second thing is, as I'm saying, inspect the packaging. There should be no tampering of the packaging. If there's any tampering, then alert the authorities, or in this case, the pharmacy. And then when you're taking your medication, take it out. It's a good idea just to put it in the palm of your hand, have a look at it, and then take it down.
When you're having a look at it, what exactly are we looking for? Just to be clear.
Okay, number one, if it's something that you've been taking, over the years, it should kind of look like, the previous batch, what you were taking. But also, normally tablets should be uniform. So if it's a white tablet, it should be, white, all white around it. It shouldn't be mottled. It shouldn't have any mold on it, say, and maybe like extra powders on it. If it's a liquid, generally speaking, it would have a pleasant smell. If you find that it's got this industrial chemical smell, then that's like a red flag.
Okay, I suppose that then simplifies it quite, it makes it a lot better and easier to identify for the layman. Lastly, are there any challenges or obstacles that you think may hinder the efforts to eliminate these medicines in Africa, particularly? And
Yeah. So Zahid, you talked about this article. There's a previous article that we actually wrote on this, and that article we were looking at the legal situation. So one of the problems that we have is we don't actually have specific laws that look at what we call pharmaceutical crime, right? So if the authorities catch me with a fake medicine, I am not charged with this potentially heinous crime, of carrying something that can potentially kill people. I am charged with the Counterfeit Goods Act, which is the same act under which I would be charged with if they caught me with a fake Gucci bag, right? So we actually need, and I think there's thinking amongst regulators, we actually need these new laws that look at a pharmaceutical crimes penal code. And that would be quite serious, right? So you're not just going to find me and let me go, but you're actually going to make sure that you throw the book at me.
Are there any instances, elsewhere that you might be aware of where such legislation has actually been tightened and actually had an effect?
Yeah, so it's interesting, right? Recently, I think in the past week, the CEO of a company in India was actually jailed for, the company was found to have produced some products that was substandard, and the Indian authorities, because they're also trying to clean up the marketplace, they actually sent these guys to jail.
Okay,
Yeah.
let's hope those legislation can actually come to South Africa and other African countries sooner than later, because I don't think it's appropriate for so many people's lives to be lost merely as a result of counterfeit medications, circulating and going around and being dispersed by vendors who shouldn't actually be selling these stuff in the first place. But nonetheless, let's leave it at that for now. Thank you so much for your time.
Thank you very much, Zahid.
All right. So that was actually an interview and a conversation with Professor David Katerere, which I had earlier on. He's a research platform chair for pharmaceutical and biotech advancement in Africa at the Tshwane University of Technology. And we basically spoke about fake medicines being a dangerous threat in Africa. He mentioned reasons why, and obviously not very good. We're seeing hundreds of thousands of children actually dying as a result of this every year. So, certainly one of the important conversations that we need to be having as well. And of course, Professor Katerere was not able to join us live this afternoon, but he did join me earlier on in a pre recorded interview. Of course, he is observing Holy Saturday today. So, yeah, nonetheless, let's take a break. When we get back, we move on to our next conversation. And that, of course, is with Mr. Kalisto Kundowe.